Hello everyone, welcome to this newscast. My name is Brianna Barrett, and today we're going to be talking about Noonan syndrome. Noonan syndrome affects both females and males. This syndrome is more noticeable during childhood because of the noticeable and detailed physical features it does at a young age, but as they get older, the patients, the features start to fade and change. Noonan syndrome affects about every 1 in 1,000 people to every 1 in 2,500 people. There are several symptoms related to this disorder. The first very noticeable symptom occurs in the eyes. The eyes of these patients are very spaced out in the head and have a slight downward slant, and with very thick eyelids. These patients are most common to have blue and green eyes, and their eyes look like a sad puppy face, which looks very motionless because of the slant. The ears are also lower than usual in the head, and they have a very thick helix. Another symptom is having a very short neck. As these patients get older, since the neck is so short on them, the skin on the neck keeps growing and growing. This causes a webbed neck, which is just a big neck. A patient with Noonan syndrome can also get the symptom of having a very deep groove here on between the nose and the mouth. Some heart systems that they can encounter is having heart muscle thickens because of the irregular growing and also irregular heart rhythm. It's very common for the patients of Noonan syndrome to have very curly hair. Around 50 to 70% of the patients of this syndrome are very short in height. And this is because of how the syndrome affects the growth hormones, causing them to be very low. Now let's move on to how this syndrome is diagnosed. A patient is diagnosed with Noonan syndrome if he or she goes to the doctor, and the doctor realizes some key features and symptoms in that person. Now moving on to the treatments of Noonan syndrome. Quite yet, there isn't an exact method to change the genes that cause Noonan syndrome, but there is treatments that could help with the symptoms that the patients are having. Heart symptoms could be treated with medications and checkups to the doctor to make sure that the treatment is having an effect to the heart. If the patient is struggling with the symptom of being very short in height, the doctor will take blood tests and examine the growth hormone. The doctor will then decide if growth hormone therapy is needed. Growth hormone therapy could increase the patient's height, but it won't be a dramatic change in the height. It will be a very slight difference. Noonan syndrome is transmitted if the patient has inherited some mutated genes from their parents, which means that the genes have had some changes in the dominant autosomal genes. There could also be some changes if an error occurred in the sperm and egg. And now moving on to Denise.